Transitioning from a fee-for-service model to a value-based compensation can be a bumpy ride. National accounting and consulting firm Moss Adams uses their expertise and experience to help physicians and administrators navigate these uncharted waters.
A big advantage for Moss Adams clients is that the company's trusted advisors, both on the consulting side and the financial side, have already worked in the healthcare industry. They've been in the trenches and know it from the inside.
In realigning providers and medical groups to operate in today's environment, certainly there's an element of change that everybody in the practice is dealing with. And we can help with that, helping them understand the direction that they're heading, implement new strategies, understand new payment models.
Moss Adams focuses on being a trusted advisor, so we listen to our clients, we go out and meet with them on a regular basis. And by understanding the industry, so we understand the healthcare industry, we can talk their lingo and go out and discuss their issues.
In many cases, the fundamental difference is the system is rewarding medical groups and other providers for keeping people healthy. And that's the direction we're heading, keeping people from having to come in and use services as opposed to being rewarded for providing a volume of services. And that's really the biggest issue facing our medical groups today.
For the folks at Moss Adams, the future is actually quite clear. And it's not just the shift to value-based care. It's also other big emerging trends like retail competition, regulatory compliance, all the new buyers of health insurance, care coordination between providers, and integration of care.
In today's healthcare environment, structuring, alignment with different kinds of providers is really important. So when you think about doing a partnership between a hospital, medical group, health plan, et cetera, a really important element on the consulting side is to understand how those providers are going to integrate.
Mark Manti, Chief Operating Officer of the Everett Clinic here near Seattle, admits his doctors were nervous about getting reimbursed under this new value-based payment, but he says Moss Adams has made that transition a lot smoother. And for the Everett Clinic, Moss Adams has provided 2 decades worth of both tackling challenges and predicting them.
The move to population health and actually getting rewarded for it is a huge issue right now that we face. And we'll be trying to do some things that help the market move in a direction that pays for value.
With a national service provider, having that perspective to say, here's what we're seeing on the national landscape, how does that apply to you in your business and how can we make you successful is really important.
Most of the physician groups are still seeing a lot of fee-for-service today, and this shift to the risk base is starting to happen. So in their mind, they're beginning to think about how are we going to be compensated in the future.
We're able to actually assign a profit loss statement to our value-based contracts, and they've been able to help us understand what needs to move the dial on profitability for taking care of certain patient populations.
All of our consultants, all of our tax specialists, all of our assurance specialists, they're obviously not providing clinical services, but the services that they do provide, they're providing to healthcare organizations. We're all about having our service providers be experts in that field, so you can rely on those experts for advice.
Different groups will come together and decide, well, we are thinking of joining a larger group. Moss Adams has tax expertise that can help them structure that in a tax advantageous way by working with them to say, does that make sense?
I think there's so much change going on in healthcare, you'd have to be nervous. But relatively speaking, our doctors are fairly confident in our course. And with trusted partners like Moss Adams, we've been able to weather a lot of different storms and turbulence.
We have what we call the Moss Adams advantage, and it's really putting the client first. And our dedication to client service, working together, and that kind of synergy, I think is really important. It's a distinguishing factor for us.
In the end, it's not really about trying to drag medical groups into the new world of healthcare delivery. It's about showing them the value of getting on board and making the transition as seamless and as financially sound as possible. In Seattle, I'm Andy Rosegen.